Welcome. Welcome to forpay.org. This is Consumers Doctor, Bengala. Risk segmentation. What the heck is risk segmentation? Let me explain to you in simple terms, folks. Insurers, your premiums are based on the risks. Insurers generally give an insurance policy on your health or anything, your car, your house, any insurance is based on the risks. So especially when it comes to health, insurers fail to segment it. I have no idea why they want to keep it as a status quo. If you're a 30-year-old, you're a 40-year-old, you're a 50-year-old, it doesn't matter. Your premium is based on the general risk pool. I hope consumers will demand this segmentation. The consumers have the power to demand because your health insurance premiums keeps rising. One of the reasons health insurance premiums keeps rising because this CEO of this big health insurance companies, they refuse to segment the risks. This is from an actuarial for 50 years. His advice has always been, if you segment the risk, your health premiums will go down. I'll give you the brief scenario, folks, how it works. 68% of the Americans are healthy. Yes, 68. Their claims are only 12%. So their premium should be a lot lower. Even traditional health premium should be a lot lower. On the top of it, if you take a deductible, like $1,000, $2,000, $3,000 deductible, your premium should go way down by 60%. Yes. I'm talking about 68% are in well category. This is number one, well category, folks. Their premiums, especially with the deductible health policy, should be way down. Yes. Folks, you need to demand insurers to to reinforce that well category premium should be a lot lower. Number two, at-risk category. If you have a high blood pressure, if you have diabetes, if you're a smoker, if you're a drug addict, you name it. There are a lot of people are at risk from whatever the illness. They have a mental illness, whatever it is, it doesn't matter. If you're at risk, your premium should be 10% higher with a deductible, because you're taking the responsibility of taking care of the deductible. Your premium should be lower. It cannot be any higher than 10% over the well category. And in this at-risk category, the claims are only 15%, folks. It's not a big number. The claims you're talking about, actually the 15% of the folks are at risk. Their claims are only like roughly the same claims, 15%, which is not bad actually compared to, you're talking about all the at-risk category. And only 15, I think it could be even much lower, 12% of them are at risk, and their claims are around 15%. You can take a look at it, folks. When you go to the forpay.org landing page, there is a book available by Ron Bachman. It's on unlocking the secrets of health insurance premiums. Unlocking the secrets of health insurance. I want all of you to read it. The third category, this is where most of the claims are, folks. Chronic illness. 15% of the US population have chronic illnesses. You know what the claims are? Almost whopping 48%, almost half of it. half of the claims are from chronic illness. This is where we need to focus our attention. I don't know why we fail to do that. We need to focus on the attention for the chronic illness category. 15% of the folks we can handle, we should be able to take care of these folks with the lower premium, especially with the deductible policy. Especially these people should take charge with health savings. It'll be big. Actually, some of them may need a certificate of guaranteed coverage. Folks with the chronic illnesses, they'll be given a certificate of guaranteed coverage by the Health Review Authority under the public-private partnership. And the last but not the least is catastrophic, folks. Catastrophic is a small segment. It could be temporary. It could be, people occupation, like if you're a pilot or if you're impending illness or whatever, catastrophic category, their claims are only 12%, folks. Only 12%. So their premium should be, and even that catastrophic could be only for a limited period of time. It's not going to be forever. So maybe a year, 2 years, 3 years, whatever it is, based on their catastrophic illness. So main focus, what we need to do is focus on chronic illness. That's where half of the claims are coming from. And if we can do that, folks, and I think I keep mentioning, people who are economically impaired, physically impaired, they're not able to take care. There are only 2 to 3%, folks. Only 2 to 3%. That is a role of the government to take care of these folks through not giving this, Medicaid card or whatever it is, the unemployment benefit. They need to be taken care of on a regular basis through once they get a certificate of guaranteed coverage, they can go to any private health insurance firm. They should have an equal access. These are the folks we need to focus on. That chronic illness category, and for people with handicaps and like a physically or economically impaired folks, we need to pay attention to these folks. Well category folks, they can take care of themselves. All of them should have health savings accounts, and that way they can grow their health savings, which will be good for everyone. It'll be good for the consumer, good for the health of the economy. Overall, the cost of the healthcare should go down. If we implement simple things like this, the healthcare cost should go down, folks. We have the best healthcare system in the world, but we keep tampering with socialized medicine, this and that, and we need to keep our so-called healthcare intact the way it is. It has to be consumer-driven healthcare under the public-private partnership, folks. Thank you for listening. If you find the values, do hit the like button, subscribe, share, and hit the notification. And we will see you in the next episode. God bless. Goodbye. Love you.